Shelby Hubbard, and I was invited here today to talk to you all about kidney stone treatments, lithotripsy versus laser lithotripsy. Kidney stones, also known as renal calculus, are solid concretion or crystal aggregated in the kidney from dietary minerals in the urine. Kidney stones typically leave the body by passage in the urine stream, and many stones are formed and pass without causing any symptoms. If stones grow to a sufficient size, usually at least 3 millimeters, they can cause obstruction of the ureter. This leads to pain, most commonly left flank pain. Most commonly felt in the flank, the area between the ribs and the hip, and sometimes in the lower abdomen and the groin as well. Nausea, vomiting, fever, blood in the urine, pus in the urine, and painful urination can also be symptoms for kidney stones. When a stone causes no symptoms, watchful waiting is a valid option. For symptomatic stones, pain control is usually the first measure using medication. More severe causes may require surgical treatment. For example, some stones can be shattered into smaller pieces using ESWL, extracorporeal shockwave lithotripsy. Some causes require more invasive forms of surgery. Examples of these are cystoscopic procedures such as laser lithotripsy or percutaneous techniques. Sometimes a ureteral stent may be placed in the ureter to bypass the obstruction and alleviate the symptoms, as well as to prevent ureteral stricture or ureteroscope stone removal. ESWL and laser lithotripsy are the most common procedures used to treat kidney stones, and the patient decides which procedure they would prefer. And this is just a picture of the kidney stone that would actually be, if the ureteroscope is actually inside, you can see it from the x-ray. Alright, now we're going to talk about lithotripsy. Lithotripsy is the most common for kidney stones in the U.S. Shockwaves from outside the body are targeted at a kidney stone, causing the stone to fragment. The stones are broken into tiny pieces. ESWL means extracorporeal, outside the body, shockwaves, pressure waves. Lithotripsy, litho meaning stone, and tripsy meaning crush. So ESWL is described as a non-surgical technique for treating stones in the kidney and the ureter using high-energy shock waves. Stones are broken into stone dust or fragments that are small enough to pass in the urine. If large pieces remain, another treatment can be performed. ESWL works better with some stones than others. The size and the shape of the stone, where it is lodged in your ureter, your health and kidney's health will be part of the decision to use the ESWL. Stones that are smaller than 2 centimeters in diameter are the best size for ESWL. And if the stone is in the kidney, 2,500 shots per minute will be administered to the patient. And if the stone is in the ureter and far away from the kidney, 3,000 shots per minute will be administered at a power level of 6. The patient will be placed on the table. A soft water-filled cushion may be placed on the abdomen or behind the kidney. The body is positioned so that the stone can be targeted precisely with the shock wave by using fluoroscopy X-ray. High-energy shock waves passes through your body without injuring it and breaking the stone into smaller pieces. Even though there is no incision, there will be pain. So you and your doctor will discuss before the procedure if you should get a light sedation or a local general anesthesia for the procedure. The choice usually depends on the technique, the type of the stone, and the patient. The recovery time is usually no more than 30 minutes after the treatment, and the patient is usually free to get up and walk around and leave the facility. Many people can fully resume activities within 1 to 2 days. Special diets are not required, but we do ask you to drink a lot of fluids. This will help the remaining pieces to pass through your bladder very easily. And for several weeks, you may pass the stone fragments. The main advantage of this treatment is that it treats the kidney stone without any incision. As a result, the hospital stays and recovery time is reduced.